Jalisa, how are you today?
Carrie-Ann, I'm good. Thanks for having me.
Oh, I am so pumped to have you on the podcast. I'm excited about all the goodness that you're going to bring to me and the audience. But before we do that, let me go ahead and introduce you first. Started in the Gold Coast upon the North Shore, grinded through his studies, got awards galore. Hit the scene with Big Green, also known as Dartmouth. An elite group of scholars is what she's a part of. You see her Rollins to Emory, where she went and got her master's in public healthcare. Now she's at Georgetown to give us help, yeah. Fighting the good fight. I'm saying hell yeah. A research fellow for health insurance reform. She's fighting for patients' rights, healthcare freedom, and health equity. So basically our quality of life and longevity. She's here to break it down from all its complexity because she knows healthcare is a straight-up necessity. Talent and passion, that's the head and the heart. Mix both them together, you get Jalisa Clark.
That was fantastic. That was so good. Oh, wow. Thank you. Thank you so much.
Absolutely.
Wow.
Yeah, I did as much digging as I could. So
my whole entire life.
Yeah.
In the past 30 seconds. That was great.
Yeah, absolutely. Well, you're gonna help us in our entire lives. So I'm excited about this conversation. What I like to do is I like to talk about fun stories in the beginning of my interview, just because everybody likes a good story. And preferably truthful stories, but we won't know otherwise, right?
Yeah. So I can tell you what happened to me during the pandemic. I first found the love of my life, which is pickleball.
Nice.
I am a pickleball connoisseur. Started playing with my grandparents and just kept going, inviting all my friends.
Mm-hmm.
And unfortunately, in a very intense game of pickleball, I tore my Achilles tendon. Dropped immediately.
Mm-hmm.
And then there was a sharp pain, and then it was nothing. It kind of went numb.
Mm-hmm.
And even though I work in healthcare, I was like, must be a sprained ankle. And so I was literally flopping my foot around for a month before a friend was like, you need to go see a doctor. And the doctor was like, how are you not in incredible pain? You tore your Achilles. Was in a cast for 2 months back home, but have done physical therapy. Now I'm back on the pickleball court.
Oh, wow. Nice.
Can't stop. Can't be stopped.
Nice.
But I work in health insurance, and that was my first real experience navigating my own health insurance because I had a medical issue. So yeah, it made a topic that I had been studying about very real to me, and it makes me want to fix the system even more. So
Sure.
would love to be here and talk about what health insurance is, what's important, and what to keep an eye out for when searching for a plan.
Absolutely. So the moral of the story is, if you feel pain, go.
If you feel pain, go to the doctor.
Okay.
Yes, and see a doctor in person, especially if you can't really describe it.
Sure.
Because telehealth won't cover all your bases.
Yeah. That reminds me of a friend. We were snowboarding, and he fell and broke his wrist, and he was in a lot of pain. And the guy was like, "Oh yeah, you're not. It's not broken. If you were broken, you'd be screaming right now." He's like, "I'm in a lot of pain." And he's like, "No." And then it turned out it was broken. And he was like, "Dude, that guy." Yeah. It's crazy. That's crazy. Well, I'm super glad that you are better now. And I'm glad to learn from you. And I'm curious on how did you get into this line of work of being in health care reform?
Yeah, so it's been a bit of a journey. So I, like many people who were starting off in college, was convinced I was going to be a doctor. And so while I was taking my pre-med courses, I saw this one class listed called Global Health. And I thought, well, it's a geography class. It'll be great to supplement, my organic chemistry classes with like some practical knowledge about global health.
Mm-hmm.
And I took the class and I absolutely loved it. It was focused on spreading the news about vaccinations and non-communicable diseases and health systems in different countries. And I was like, this is what I want to do. This is what I want to study. I was also pretty squeamish with
Sure.
so I was like, I'm not going to be the best doctor. So after undergrad, I applied to grad school at Emory, and I went in. I did the health policy course. There was a global health course, but I was like, if I learn health policy, I think I can apply that to any country. Like that would be my basis.
Mm.
And while studying health policy that was focused on the U.S. healthcare system, I was like, wow, before I go to another country to try to improve their healthcare system, there is a lot of work that needs to be done in the U.S. from every single angle. And so, and that's how I got involved in health policy, and now I'm in health insurance, which is a whole nother gambit of health policy.
Absolutely. Yeah, absolutely. And it is quite confusing. I had like 7 options. I didn't have a lot of options. And I was looking at my options and I was like, I don't know what to do. This is not good.
Yes, it is a fight. And it's one of those things like when you talk about like in high school, it doesn't prepare you to, do your taxes. Nothing in your curriculum from high school, undergrad, even grad school prepares you to pick a health insurance plan. So I can go into the basics of like the different types.
Sure, please. Yeah. And before we do, there's a lot of vocabulary, quote unquote, that you might be referencing, and acronyms and jargon, and you're just like, oh, what is this? So can you talk about what is a premium? First off, what's a premium?
Okay, yes. So a premium is basically the cost of how much you have to pay to have the insurance, just to have the product, not for the insurance to cover other services, but how much you have to pay that year to be covered. And that's typically broken down by the month.
Right.
And that's typically the most expensive part of health insurance.
Yes, it is a pretty penny. Gold plan. I don't know. but okay, so there's the premium, then there's cost sharing, copays, and coinsurance. So could you talk a little bit about that?
Yeah. So once you are paying your premiums, once you have access to health insurance, the next thing you have your deductible. And that is how much money you have to spend out of your own pocket before the other cost sharing starts to come to play. So your copay, your coinsurance. And your copay is a set price for a procedure. So once you hit your deductible, once you've spent, literally like $2,000 for a single person of your own money, then the next services will be a flat rate for your copay. So that could be $20 or $40 for a prescription drug instead of the $160 that you were paying before you reach your deductible. And coinsurance is the same thing as a copay, but a percentage. So that'll be 10%. So let's say you broke your leg, you went to the hospital. Okay. You've been paying your premiums, the amount you pay every month. That's maybe $200, but you haven't paid anything else. You haven't used your health insurance at all. So you get to the hospital, you have a broken leg, you're there for a day, they run up the costs, and it's $6,000. Okay. Your deductible is the amount of money that you're set having to pay. So if your deductible was $2,000, out of that $6,000, you are guaranteed you're going to pay $2,000. Then there's a remaining $4,000. Now that you've reached the $2,000, your insurance will pick up the cost. So if it's coinsurance, then they'll cover 90% and you'll have to pay 10. So then instead of paying the $4,000, you're paying $400 for the remainder.
Got it.
If it was a copay, if they had like a set, $300 copay for hospitalization, then you just pay the $300. All in all, a lot of money,
Sure.
but less than the money that you would pay out of pocket for the one hospitalization without insurance.
Sure. Absolutely. And is there a place where you just you just stop paying? Is that a such thing?
Yes, right. Yeah. So that's the out of pocket limit,
Hmm.
and it changes every year. I want to say this year for a single person it's about $9,000
Hmm.
for a plan in the marketplace.
Hmm.
Different plans can differ. But yes, and that's basically like you have spent so much of your own out of pocket money. Sorry,
Hmm.
this does not include your premium. This
Right.
doesn't include the original price tag. That the insurance is going to take over the rest.
Hmm. Hmm. Okay. And does that include copays and coinsurance? That does, right? Or no?
Yes, it does.
Okay. Fabulous. Fabulous. Okay. Cool. So there comes a point where they stop charging you.
There does come a point.
Okay. Good to know.
And then the next year you start all over again.
Yes, of
At
course. Of
zero.
course we do. Yeah. Very, yeah.
Mhm.
As it is. So there's a lot of different options. Um 76 depending on where you are on the exchange, right?
Marketplace, yes.
Yeah. So I see a lot of HMO, PPO, HDHP.
Yeah.
Can you break down what those three are?
So HMO stands for Health Maintenance Organization, and
Hmm.
this is the most limiting health type of health plan.
Hmm.
So basically, the insurance company is like costs across the board are too high.
Hmm.
But we're willing to make partnerships, make deals between certain hospitals, certain doctors, and certain services so that it's cheaper for us if you go there. So when the HMO says you can only go to these places. So before going to an HMO, you definitely want to look up the providers, you want to look up the hospital, you want to make sure that the hospital in your HMO plan is the closest hospital to you and not the hospital, the furthest away,
All right.
right? In case there's an emergency. So things like that.
Hmm.
A PPO is a preferred provider organization. Yes, yes. And
Hmm.
that is based like an HMO, where there are specific hospitals and providers they want you to go to. But let's say you've had a dermatologist that you've gone to your entire life who's not in the preferred, the insurance will still cover some of your bill if you were to go outside of the plan. So
Hmm.
there's more flexibility.
Hmm.
And so those are the two that are kind of people talk about together because they're more like cousins.
Hmm.
Then there's the HDHP. So this is a high deductible health plan. And this is, it's kind of just what the name says. It's got a high deductible. So it means that you're already paying the premium that's guaranteed, but then you might have a $3,000, or actually $1,500, I think is the lowest for a single person deductible that you have to pay money from your own pocket before your health insurance kicks in.
Hmm.
Um, and HDHPs come with an option of having a health savings account, which, well, that's a whole new another brand of acronyms that I can discuss
Sure.
if you like.
Yeah. They go together often. So
They
yeah.
do go together, yeah.
Hmm.
So HSA, FSA, and HRA. So I'm personally a fan of health savings accounts,
Hmm.
HSA, which come with a high deductible health plan. There are pros, there are cons. This is really being studied right now because the number of people in high deductible health plans with HSAs are rising. So there's a lot of study on this topic. But the one thing about a health savings account is that it's your account and it goes with you from place to place. So basically, how it works is that sometimes your employer may contribute money, or you'll put in money out of your paycheck into this savings account, and it's just like a bank account where you add funds, and then you can even sometimes companies will give you like a debit card, a health card,
Sure.
and you can swipe it and use it for health needs. So there's a list of approved products and it changes and is updated every year. You can use it at CVS for like cough drops. You can use it or your pharmacy to pay your drugs. You can use it at your doctor's office. And so this is your own money. This is your money that's coming from your paycheck. This is money that you're adding to this account, but it's for a health purpose. And the one big difference between an HSA and an FSA is that the funds stay there over the years. So sometimes you may be talking to your friend and they'll be like, oh, I have to buy something.
Right,
My friend bought one of those red lamp lights that's like supposed to be good for healing and like
nice.
good energies. There's like $300 for a lamp, but if his money is not spent, it won't carry over to the next year. It's effectively gone. An HSA,
got it.
Yeah, that's an FSA. So it's limiting. An HSA, the money that you put in, it stays in. So that's the real benefit of that. But that's for people who are healthy, or they know how much they spend and they're pretty confident that they won't be spending money, that they're able to go into this high deductible plan because they're actually like, I'm actually never even going to need, my health insurance to cover my doctor's visit. Like I can afford, paying $100 to see my primary care provider. And I'd rather do that than go into another plan that has a higher premium, a higher price tag, but I don't really use the services. So it's a tough decision, but it's a little bit of a gamble.
Yeah. And what HRA? Please speak on HRA because you mentioned it.
Yes. So in HRA is it's similar, but your employer owns the account. So like an FSA, it doesn't go with you if you were to leave your job.
Right. Okay.
An HRA is also different than an HSA because only your employer can add money to it.
Right.
So you don't really have as much say of how much money you're adding.
Got it. Okay, cool. Good to know. All right, let me do a little something with that. Here we go.
All right.
Got an HMO. I got a lot of restrictions. I don't really like the restrictions that they put on me. So PPO, it might let me go see other doctors that are not in network and they'll pay a part of it. That is cool. HDHP is high deductible. Comes with an HSA. That money will just go with you. It's opposite of the FSA and HRA, so you can maybe get some money from that thing that you accrue on the interest now. Maybe I might be sharing too much, but I come through with Money Clutch. That's how I do.
All right. Yeah, that's great. Yes, you bring up a great point. You can invest the money in your HSA, I think, once you get to 65. So it's also, and it's not taxed. So
yeah. Some people I know who are like trying to retire early. They're all about the HSA because of the interest accrual. From what I understand of it, I don't know much, but yeah. Very cool.
That's another aspect of it.
Yeah. Awesome. Okay, so
I will say this. One little thing. The best case scenario of an HSA is that you have enough money in your account to pay your high deductible in case you get hurt.
Yeah. That's good. That's a nice little strategy. Just don't get hurt. That's my strategy in life.
Bubble boy for the year.
Yeah, exactly. Yeah. Oh, I think I'm ready to take some risks now. I think I'm. Let's go do some crazy stuff.
I can go outside.
Yeah,
I'll use my oven for the first time. Yeah.
That's funny. That's great. So, there's so much information about just options, right? It feels like I don't know how you are with shopping, but when I have a lot of options, it's tough for me. So like,
too many options.
Too many
options.
Yeah. So let's talk about the general options in regards to insurance, and then we can talk about, if you want to start talking about employer versus the healthcare exchange, you can.
Yeah. So most Americans are an employer-sponsored plan. So that's about like 49% of people in the U.S. The next largest group are people in Medicaid, including children who are in Medicaid, and that's about 20%.
Sure.
Then it drops down to Medicare, 14%. Then unfortunately, there's the 9% of Americans who are uninsured. Then there are about 6% of people who are in the non-group market. So these are people who are in the marketplace, who are maybe buying an off-market plan, which are, I won't get into that. That's a mess, but there's not real coverage, so I'll say that. And then there's like 1% of people who are covered by the military, so that's like the VA.
Sure.
But when we talk about insurance, if we're talking about Medicaid, we talk about Medicaid. When we talk about Medicare, we talk about Medicare. So insurance really means employer-sponsored insurance, and then private plans, which are plans you go to healthcare.gov and you see all the tiers that say bronze, silver, gold, platinum. Those are the private plans that we typically talk about.
Okay, when you said tiers, I was just like thinking of, you see all these tiers of people trying to...
Yeah. And it's so crazy because, I know health insurance, but I don't know metals. And I was like, is platinum better than gold?
Sure, yeah. That's great. Okay, so, let's talk about employer insurance first. What insight and advice do you have on getting insurance through your employer?
So the great thing about employer-sponsored insurance is that there are way less options presented to you than if you were to go in the marketplace. So when you look at your employer's options, you want to think about your own health needs. So basically, if you already have an ailment that you know of, you want to maybe look through and see like, how many times do I go to the doctor? How many times do I get this prescription fulfilled? To get a sense of your healthcare costs. You also want, if you have a primary care physician, you want to be like, I like this doctor. I want to make sure that they're covered in this plan. So that's something to keep in mind if you see an HMO, PPO.
Sure.
Is my doctor covered? And then you also want to take a look through the summary of benefits and coverage. So the SBC, and that has different questions about like, what is not included, what's not included in the plan, or what is the overall deductible. It has like quick bits of information about that insurance plan. So those are things you keep in mind with your employer-sponsored insurance. And also how much you're willing to lose from your paycheck. That's also important.
Sure. Yeah, absolutely. Okay, so let's conquer this behemoth called the healthcare exchange.
The healthcare exchange is like, honestly, call for help. No, seriously, there are navigators and there are brokers and there are people who are paid to do this professionally because there's so much to navigate. As you mentioned, you sometimes are presented with literally 70 options. And in my research, when we talk to advocates, this is something that comes up over and over again. There are too many choices. There's America loves capitalism, too many choices in this circumstance. One of the things I recommend if you're new to the marketplace this year are types of plans called easy pricing plans. And so you can find them by clicking on the healthcare.gov filter, clicking on a metal level, bronze, silver, gold, or platinum, and then easy pricing. So the thing about easy pricing plans is that they have a whole list of services that have the copay and coinsurance before you hit the deductible. So let's say that, you take a certain prescription year round, right? If you know that it costs $200, you can, look at a easy pricing plan, or also known as a standard plan.
Sure.
And if it's in the list of drugs, you'll have to pay $40 for that without meeting the deductible. So that's really a great option for people who know what they're spending their healthcare dollars on. Other than that, bronze, I'll go back to the tiers. I forgot, I skipped over the fact what do they even mean? So bronze, silver, gold, and platinum, they're meant to give the shopper a sense of how much your insurance is covering versus what you're covering. So they'll have a percentage. So they'll have an actuary value. It'll be like 74%, 80%, 90%. And at the lowest, at the bronze, they're saying that 74% means that the insurer will, on average, cover 74% of costs, and then you'll have to pay the remaining 26% of costs. And then, so when you're in a higher plan, if you're in a plan that has, a 90%, if the insurance company is covering more costs than they would at a lower tier plan. However, it is slightly misleading because it's an average of all healthcare expenditures. And the difference between the lowest person who is, with the lowest healthcare needs compared to the highest is so grand. So really, you have to be spending in the thousands, right, to really get that actuarial percentage to really have your insurance cover 74%.
Got it. Wow, that's that's great. Wonderful.
It's a mess.
Oh, wow. Okay.
Yeah.
Okay. All right. Yeah.
Yes. But at first instinct, you would be like, all right, well, if this is the case, that my insurance is not really going to kick in for a long time, I have a deductible, I'm going to go with the lowest premium plan. And that would be a bronze plan. But the Biden administration, Obama administration, have been really trying to make quality healthcare more affordable. So there are a whole bunch of cost sharing reductions for silver plans. And you have access to this, a cost sharing reduction based on your income. And basically, the cost sharing reduction, or the CSR, impacts your deductible, impacts your copay, impacts your coinsurance. Things that aren't the premium, things that you can't see up front, but will lower the cost that you're spending out of pocket. So if there is an option and you have access to cost sharing reductions, the silver plan is the smarter plan than the bronze plan.
Okay. Got it. Sure. Yeah. And what was the name of the easy pricing is what you said, right?
Easy pricing. Yeah.
Got it. Okay. So maybe easy pricing, maybe silver might be up people's alley.
Yeah. And it's hard because when you're fronted with, when you first see health insurance, the first thing you see are the premiums. And it's like, how do I ignore, a $200 price tag, and a $500 price tag?
Sure.
But then you have to look at the deductible. And if the deductible is super high, then might as well not even have the insurance, right? If the benefits of insurance take forever to reach. And then you're like, well, what are the benefits? And then you have to check the cost sharing, and you have to check the coinsurance and make sure that, you're getting a good deal. $20 to see your primary care provider, that's a steal, So maybe it is the easy pricing that allows you to get that before the deductible. It's a guessing game.
Oh, wow.
And it's one of the messy things about insurance, right? You never know how much insurance you need until you need insurance.
Yeah, absolutely. Absolutely. All right. Well, I want to revisit the whole idea of getting help at the end, because I'm feeling for people right now. I'm just like,
yeah.
So, okay. So you talked about cost sharing reductions and qualifying. Are there any other maybe discounts, subsidies that people get? I mean, it sounds like it was income based.
So there are tons of subsidies on the marketplace for people looking for insurance. And it's actually kind of strange because subsidies in the marketplace, it always pops up in the news. It's always being debated about in Congress. But the actual effects are typically not talked about. But I don't remember if you remember, in August, Congress was taking a vote on the Inflation Reduction Act.
Right, yeah.
And it passed. And so that has allowed for more premium tax credits for the marketplace. So basically, if you're making 400% or less of the federal poverty level, there is going to be some kind of cap in the amount of money that you're paying for a health insurance plan. So 400, like, to give you an idea of like where this is income wise. if you're a single person, a household of one, and you're making $54,000, yeah, 54,000, or a family of four and you're making 110,000, the amount of money that you're spending on your premiums, your price tag for health insurance, is going to be capped at 8.5% of your income.
Sure.
Right. So that is the most you'll be paying for premiums in a plan for the marketplace. But then if you're making less than that, the subsidies increase. So if you're a household one and you're making $20,000 a year, your premiums could literally be $0. No, they could be capped at 0% of your income, which is $0. Sure. And it's more common, I think, than people realize. I think last year it was about 1/3 of people who got insurance through healthcare.gov selected a plan where the premium was $10 or less a month. Right? So
wow.
Yeah, so we talked about how health insurance is expensive because you see the original price tag. But, Congress is working to make it more affordable for people. And it's kind of a shame because, there's only 50% of the people who qualify for that lower bracket. And we're talking like 0% of your income, 2% of your income, only 50% actually sign up for a plan. So there's, the uninsured Americans, there's options for health coverage. If it's not in the marketplace, then it could be through Medicaid.
Okay. And Medicaid, it's a zero cost because you're at a certain poverty level or income level where you don't pay, right? Basically.
There might be some additional fees, but it should be manageable for the family. I'm not quite sure if it's exactly zero.
Okay. All right. No worries. All right. Cool. And all right, let me do something with that. There are discounts out there, a lot of things out there you need to be aware. I'm telling you right now to try to put your info in and get discounts so you can save money. Then you might save a whole lot of money, a lot of yen. I'm talking about a lot of money that we got. You might pay $10. That is not a lot. Subsidized, baby.
Started from the bottom, now we're here.
Yes, sir. You got to start somewhere, and the bottom is a great place, right? Yeah. Only up from there. I do. When you were talking, I heard something on the radio just this morning, about what's that thing called? A life-changing event.
Life-changing event.
Yeah, like what is it? Lost your job. You had a baby, you had triplets. There's all sorts of stuff, right? So
there's so different stuff, and it kind of changes by state. But yeah, you move out of state, you move to a different place. Your insurance plan doesn't exist anymore. These are all circumstances in which you can enroll for insurance outside of the open enrollment period. So the healthcare.gov open enrollment period started November 1st and will go until January 15th. Some states have longer, some states have shorter, but in general, that's the period. And then it is kind of scary because if you don't enroll then, you can be left out of options after the open enrollment period. But yes, a life-changing event will start a special enrollment period where you can then, sign in to get insurance. And one of the biggest changes during COVID was just extending the open enrollment. COVID shocked the country, shocked the world, and it became apparent that no, people need to have access to health insurance year round. So Biden extended open enrollment, and people were able to apply for coverage then.
Sure. So let me get this right. Backtracking. Yes. So you're saying that you could not sign up for insurance, move, and then have that as a life-changing event, and then you can sign up for insurance?
Sorry, no.
Okay. Sorry.
Yes. You have to have been in a plan.
Okay, cool. Yeah, I thought so. I heard that wrong. I was just like, I must have heard that wrong.
Yeah.
Okay.
Yeah.
Okay, but you can at any time change your insurance if something happens. That's life
Yeah.
changing. Okay, cool.
And there's, there's tons of different circumstances, and, some states will allow it if you get, if you're going through a divorce, there's protection for people in domestic marriages and dealing with domestic abuse. So, and also one of the things they changed this year is because of, COVID-19 and realizing all these barriers, they've eliminated a lot of the paperwork that people needed to submit before rolling in a special enrollment period. So, which is good.
Absolutely, 100%. Okay,
and
so
there's actually, sorry, I just want to plug
no,
this.
it's fine.
If you're making there's this new 150 FPL. So if you are making 100 or 50% of the federal poverty level, so if you're a low income, you can enroll in insurance year round. It's a standing special enrollment period. It's new. So if you miss the January 15 date, which I'm not encouraging people to do, but if you do, and then you're like in May, you're like, this is ridiculous, I need insurance. If you're in that income bracket, you can just sign up for insurance.
Okay, cool. So there are people out there who can sign up year round and I guess have a technical life-changing event. Cool. Okay.
And there are a lot of products that are insurance adjacent or insurance but not full coverage that you can sign up for after the enrollment period, such as like a short-term limited duration insurance plan.
Right.
But the thing about those is the reason why you're able to sign up for them is because they're not ACA compliant, which means that they, will not cover the same services that you might expect a typical insurance to cover. So that's a gamble, and you have to really read the fine print for those plans.
Right. And I've heard there's there's some sketchy stuff out there where you
my gosh, there's so much sketchy stuff. There's so much sketchy stuff. There's things like, people who will Google health insurance and maybe like sometimes the first website will pop up will be a company not selling an ACA plan, but still technically selling insurance.
Sure.
And, what catches the eye is like, we got low rates. And so people will unknowingly sign up for these plans. And if that is the case, and you do realize that if you feel like you were misled, you can apply to get a special enrollment period to then get into an ACA or market plan. But it's a business. It's a real strategy for these organizations and companies. And there was a great study one of my colleagues did, doing like a secret shopper survey. Calling up brokers, looking at websites, asking about like, I'm looking for insurance, and many of the times the first option that they recommended wasn't a full benefit ACA plan. So we need Congress, we need the FTC, we need people to get involved in that.
Right. Is there like a Yelp for healthcare providers to read reviews, or a grade level A to F, like a Better Business Bureau kind of thing? Is there anything like that?
There is. The first one coming to mind is the NCQA, which is, I don't know what that acronym stands for, but they're a private organization, and by state, they rate each provider.
Okay.
Each insurance carrier.
NCQA.
And they even have some that they, rate on, multicultural distinction and health equity of like how diverse the providers are and stuff like that.
Sure. Yeah, that's all very important. So, okay. I feel like I feel a little better. My blood pressure rose and now it's coming down a bit. So that's good. So we've talked a lot about things to think about. Is there anything else that other information that people need to have just to make a good decision? Because,
Well, kind of tied with this is once you select your health insurance plan, that is not the end of it. I feel like a lot of times people will select a plan and they'll be like, "Oh, I'm covered. That's it, and I'll use my insurance when I need to."
Sure.
there needs to be more health insurance literacy, which is basically like getting the most bang for your buck.
Sure.
Like if you're buying a marketplace plan, there are a list of preventative services that you can get without having to pay the deductible, meeting the deductible.
Mm-hmm.
It's like, use it, make sure that if you qualify for screening, get that screening. And
Mm-hmm.
where that really starts is making sure that you have a primary care provider.
Right.
I was literally talking to my sister about this because she was talking about how she doesn't like her HMO
Mm-hmm.
that she has, because every time she wants to see a specialist, she has to get a referral. And I was like, yeah, referrals, I can't stand that. Like sometimes there's like a time delay. And she was like, well, no, I don't have a primary care provider, so I can't get a referral. And I was like, well, if you don't have a primary care provider and you can't get a referral, then you're not using your insurance. And I think it's harder for millennials and Gen Z because we travel a lot. We also think we're invincible. We just came from having a pediatrician, haven't found a new doctor. They tend not to have a primary care provider. But if you don't have a primary care provider, you're kind of losing out on a lot of the benefits to having health insurance.
Mm-hmm. Mm-hmm. Okay, so definitely find a good doctor and let your doctor be your, to some degree, your advocate and also your point person.
Your physician also, there's some nurse practitioners can be a primary care provider. Physician assistants could be a primary care provider. You just got to have one. You just got to have your PCP.
Mm-hmm. Absolutely. Okay, so let's say this happened to me, right? I hate to out my doctor, but whatever. I got extra services that I didn't know weren't covered.
Yes.
And I really wasn't happy about that because I didn't really need Botox. I was like, really? You're giving me Botox? No, just kidding. But
I was like, you look so young. I see,
yeah, it was wonderful for 6 weeks. No, but like I got all this extra stuff and I was like, why am I getting a bill for my physical? Like this should all be free. And like it turned out that there were things on a la carte that I did not know that I was getting. So how do you avoid that, and how do you like play, I guess, defense is what I'm asking?
Yes. No, it's hard because typically the attitude of doctors are like, I went to medical school to help people, not to be an accountant. And it's like, yeah, that's great. In an ideal world, you would just save us. But if we're healed but we have no money, then like unfortunately you have to take into consideration costs. And it's muddy, and it's also part of our culture because you're kind of taught young that doctors, police, and firefighters are like a group that you just listen to because they're the experts. But when you get into the doctor's office, you have to kind of just keep asking questions. Like, will this be covered? Will my insurance cover this? And they still may get it wrong. They still may say yes, and the answer is no. But they'll also may say, I'm not quite sure. I can check.
Right.
And that's important information for you to have. You also want to take a look at your own benefits before you go to the doctor's office. For example, one of the preventive services covered through your insurance when you have a marketplace plan is a diabetes screening. However, it's only for people if you're 40 and up and you're obese and overweight. And it's also what's interesting this is a little tangent, but it's interesting about these kind of age limits, right? Like the diabetes 40 is that every year they're kind of called into question, and different advocates are like, we need to lower it, or people are like, no, we need to higher it. No one's using it then. Like, it's too cumbersome. So these are always up for debate, but just information you should know.
Sure.
And then let's say you do go to the provider. You go to your doctor. You think everything's fine. You get the bill. You don't understand it, right? Then you'll get what's called an explanation of benefits, your EOB, and that will break down the services you got as well as the costs and what your insurer will pay. So always double check that. And if you get an EOB that like is too vague, call your doctor and ask for clarification. It's kind of brought up a lot, and it's not something that seems real, but oftentimes if you do ask for an itemized, list of the services that actually you got, they will drop some of them, and the price will drop as well.
That's good. All right.
So. America, it's a flawed system.
Well, fight them tooth and nail every time.
Fight them tooth and yes, literally every single time.
Yeah, I like that. That's good. So couple things. I want to hear happy stories and of someone who got insurance who really, the happiest story you can maybe think of how they got insurance and it changed their life and it, maybe saved them or whatever it is, because oftentimes people just don't realize, how fortunate getting insurance can be.
Yeah. So mostly my work, we are talking about the sad stories, but
I want one of those too. But go with the happy first.
Most of the time we're just complaining about.
Yeah, sure.
Insurance is super important, and I think that you get old faster than you think. So, for young people, one of the most common things are, depression, obesity, anxiety, and these are things that cost a lot of money, a lot of money on your own out of pocket. And insurance allows people access to care that, someone starting out in their career just wouldn't be able to afford. And there's tons of work that needs to be done in the mental health space because, people still are typically paying, reaching their deductibles before their copay and insurance kicks in. But then it still opens doors and allows people to get to see providers that they wouldn't see before. I'm trying to think of just a simple happy story. I mean, the most classic ones are people who went to the doctor, got a screening, and was able to catch something early on. Like those are the best stories you can get at healthcare, and that's why it's important to have a primary care provider to get those preventative screenings. But yeah, and honestly, one of the things that we don't do great in America is we spend a lot of money working on chronic conditions, right? So we do a lot of, heart surgeries and stents and cardiovascular surgeries. That's where we throw money, paying for these prescriptions. We don't throw a lot of money at preventative services. We don't spend a lot of, we don't have billboards. You don't get ads on TV, talking about going to get a screening and a checkup. But those are the most cost effective. That is where you will save money. If you go use your insurance, use the benefits that your insurance has to give you because of the ACA, and find out about your body before the condition worsens.
Absolutely.
You want to have a relationship with your PCP, kind of like, your parent. Like when I first moved out of my home, I would call my mom and be like, how do you boil pasta? Sure. There's Google for that. It's like, yeah, I could trust Google or I could call you. You want a relationship with your primary care provider when you're in the shower and like you hurt your back, you're like, I could Google this.
Sure.
Or let me just schedule an appointment with my doctor. Also, I just want to talk a little bit about appointment times. If you have a primary care provider, if you're a current patient, you're able to see your doctor sooner. And wait times to see doctors across the board are increasing. I think the average is like 30 days. Right? Yeah. So it's better to build a relationship early on so that when you need a doctor, you're not scrambling to find one.
Sure. Absolutely. Okay. So do you have any other because I spoke to someone who I respect their opinion and I respect them as an intellectual person. There's a lot of pushback on getting insurance for, a lot of things that we had already discussed. Is there anything else you could, your final nail in the coffin to be like, and this is why you need insurance?
You need insurance because you can't predict life.
Sure.
So that's the selfish, that's the self, your interest in mind reason to get insurance. Mm-hmm. The other reason why you need to get insurance from the economic standards is even if you think you're healthy, you enrolling in a health insurance plan makes us all better.
Sure.
Because your contribution to the premiums helps balance out the high medical costs. Someone who is, has stage 3 cancer and is like going through the worst time in their life, your healthiness and your lack of using expensive services balances out and makes it affordable for that person to get coverage. That's like the community aspect, which is a really important component of health insurance. It's the balancing out, it's the give and take. You give it now, then later you'll use this more.
Okay, cool. All right. Okay, we're getting close to time, so I'm gonna first ask you. We talked about local assisters and brokers and whatnot, and where can people go if they still have questions? Which I'm sure I still have questions.
Yes.
So where can people go, and also, how do you suss out good brokers from bad ones? Because local assisters, from my understanding, they don't make money off of working with you, but brokers do get a cut. And so, how do you pick out the good ones versus the bad ones?
Okay, great questions. Short answer, I don't know. It's kind of like it's kind of give and take. Though it is a situation that a lot of people are thinking on, a lot of people are reflecting on. Sure. The Connecticut has this really cool program where it's encouraging people from diverse neighborhoods where there's low insurance rates, to become brokers. So it's like paying for the broker class, providing people a laptop, with the idea that if you have a broker from the area, that you'll trust them more. Mm-hmm. Also, brokers tend to be white men. So this broker academy, which is the name of the program, is diversifying the broker career. So that's one way. That's one example of people trying to make sure that brokers are more accessible. Mm-hmm. Navigators are different, but navigators are great. And the Biden administration just spent a whole bunch of money on, funding navigators across the countries. If you go to healthcare.gov, you can find a navigator who speaks your language, whether that be Cantonese, whether that be Swahili, Tagalog. There's navigators, American Sign Language. Mm-hmm. That's great. There are navigators to help you enroll in insurance that way. For general questions about health insurance, I recommend you go to one of the projects that I spent this year working on and that Georgetown produces every year. Mm-hmm. It's the Navigator Guide. Mm-hmm. So that's at Georgetown University Center on Health Insurance Reforms, the Navigator Guide. Mm-hmm. And it breaks it down into every category. So you're looking, like, if you have employer-sponsored insurance, you're looking at private insurance, you're an employer yourself, you're trying to figure out the plan for your employees, you're a navigator. Questions about how insurance plays into retirement, questions about public charge, which I do want to mention. It's changed from what the Trump administration said. Basically, they said if you received any type of government aid in the form of SNAP or CHIP, Medicaid, or subsidies, that would impact your application for a visa or permanent status. That is gone. That is erased. So if you were worried about that before, if you were worried that signing up for Medicaid or getting a subsidy would impact your application, That is no longer the case, which is great. But all these very specific questions, we even have a page dedicated for diverse communities. So if you're looking for insurance and you're not quite sure where to start as a trans individual, or you want to make sure that you speak a different language, how to make sure you find providers that speak that language in your insurance plans, all these questions and more are on the Navigator Guide. So that's a great resource to go to for all your, even like very specific questions you may have about health insurance.
Wow, that's amazing. Okay, so let me do something with that, because that is that we're ending on a high note right now.
Okay, let's go. Yeah, that's the hope.
All right. Yo, come through and you slide. Georgetown Navigator Guide will help you in your state so you won't make mistakes. It will help you with your individual situation. And don't forget about us sisters that are local to your state. All right.
Yes.
All right.
That was great.
Thank you. So, I've gone through all the things that I feel like were very important to go over. I'm gonna just leave this open as a final thought, and it's anything you kind of want to share. Not your social security number, keep that to yourself. But whether it's life knowledge, whether it's healthcare related. I just kind of like to open up the floor and let you just speak.
Yeah, I would say that no one likes health insurance, but health insurance is important. If you're enrolling on the marketplace, you could really pick a plan in about 10 minutes, as long as you know certain information about like how much you make that year, some information about the taxes you paid. A plan is better than no plan. And here's my plug for primary care provider. Get a primary care provider. Check on your body. You're not invincible. Always make sure that you know your health status, and going to a doctor and checking out things is one way to do that.
Okay, cool. All right, very cool. You know what? That is all good stuff. I'm gonna end with a little bit of my my signature sauce.
Okay.
Yeah. Let's see. Here we go. Oh, there it goes. All right. Here we go. Oh, there we go. Yo, talking about things we need to see. Our own PCP. That dude, or maybe a lady, will help you come through and not be crazy. You got to understand what's going on with your body. Don't be sloppy. Come through all day. I'm talking about the ACA. You got 10 minutes. You might be finished. If you know information that you need to understand, to fill out the things called the form, you'll come straight through. It is the norm. You got to have insurance so you could understand how things happen that you don't plan. But that's the way you're going to be the person that you want to be and open up a whole good future for yourself. You need that help. You get a bunch of people from Georgetown and other places that'll help you through. And that's how you do. Spit a freestyle. You'll make moves. Come off the top. And that's how I go. Healthcare right there. Up in the flow.
That was really great. We don't have any kind of arts or music in health insurance ever. So this is a nice spin on it.
we need a Pharrell Williams happy song about healthcare.
Honestly, yeah, the health insurance could get some PR.
There you go. Very cool. Awesome. Well, thank you so much. I'm gonna link the Georgetown the Navigator guide into the show notes, and anything else you want me to link in there, I will make sure to do that. At the end, I always open it up if you want to share any of your social media as far as people connecting with you online. Again, no social security number, just social media. And if you don't want to share anything, that's fine too.
No, I'm very big on Twitter while it's still here. So you can follow me at Jalisa, Jalisa Health. One word.
Yeah.
It's my brand at this point. So Jalisa Health.
There you go. I will make sure to tag that as well. Well, Jalisa, thank you so much for your time. I really appreciate the conversation. I know you have so many things to do, but I really feel very helped by this. And hopefully, I'm looking forward to putting it out there in the world.
Thanks for having me. This is great.
Yep, absolutely. Have a good day.
And my first time doing a podcast. So
there we are. That's awesome. All right. Great. Have a great day.
You too.